Welcome back. This is KTN Prime. Now, it is emerging that the county governments are now employing a new strategy seeking to resolve an old problem. With the nurses' strike now in its 5th month, counties appear to have changed tack, choosing to engage county nursing officers in negotiations as opposed to the Kenya National Union of Nurses. And as our Timothy Otieno now reports, aggrieved officials of the Nurses Union are not taking it lightly.
137 days and counting, and it appears the longest strike in Kenya's recent history is not about to end anytime soon. Endless boardroom meetings between the Nurses Union officials and the county governments, it appears, is not yielding any meaningful result, as a majority of Kenyans continue to suffer due to lack of essential services at public health facilities. And now, county heads have put their heads together and have seemingly drawn up a new plan. In a memo dated 16th of October 2017, governors invited county nursing officers for negotiations that took place today behind closed doors. Today's meeting coming just 3 days after governors snubbed fresh rounds of talks with the Kenya National Union of Nurses officials, which had been slated for Monday. The meeting, which involved county nursing directors in more than 37 counties, was held in camera, and governors remain tight-lipped on any progress of the new talks. Those not shying away from expressing their displeasure, however, are the union officials.
The Ministry of Health wants to kill this union, and that's why they're trying to engage our colleagues who have no mandate in law to discuss matters of the trade union.
We are not party to that meeting, and the outcome of that meeting is not the decision of the Kenya National Union of Nurses.
The long and protracted industrial action is now weighing its toll on the country's health. Children are missing out on much-needed vaccination, and maternal deaths have so far doubled compared to the same time period last year. But the national government is trying to mitigate. Today, Health Cabinet Secretary Cleopa Mailu, in partnership with Amref International, UNICEF and the Kenya Red Cross Society, launched the Catch-Up program, meant to send 330 volunteer aid workers to the country's 11 most affected counties, including Turkana, West Pokot and Baringo.
Children are being born, they are not getting immunization, and therefore we are at a risk of bringing down the indicators of immunization in 11 counties after the assessment.
The CS is, however, calling on the nurses to end their strike, promising to help resolve the matter within the next 30 days. Nurses are insisting on a 15,400 per month health risk allowance and a 40,000 Kenya shillings increment in their uniform allowance over the next 4 years.
We can discuss, we can be able to agree on a figure, reasonable, and embed it into a financial year, 2018-2019.
We don't want a whole cabinet secretary going to the media, tweeting and saying that they are ready to pay uniform allowance and health risk allowance in the next financial year, when that offer has not been given to this union formally.
The counties have now seemingly sidelined the union and are negotiating with nursing boards at the county level. So far, at least 4 counties, including Uasin Gishu, Nandi, Kiambu, Bomet and Marsabit, have their nurses back to work. Timothy Otieno,